The devices themselves are essentially programmed to deliver a very specific correction to the spine. A lot of buzz around the transition from traditional healthcare towards enabling technologies and digital, the transition to mass personalization, driving better outcomes.
Onyx Live is proudly sponsored by Humphreys Law and Panacea.
Mike Cordonnier, CEO, Chairman, co-founder of Carlsmed.
Fantastic. Could you give us a bit of career background? What led you to co-founding Carlsmed?
Yeah, so lifelong medtech entrepreneur, executive, and long story, but started Carlsmed to solve a really big problem with spine surgery. I was inspired by my father. I had another spine startup more than 20 years ago when my father had a spinal deformity and needed surgery. At the time, he wanted me to design everything for his surgery, but that really wasn't possible 20 years ago. And so fast forward 2018, decided to start a different kind of company that really focused on adult spinal deformity and being able to actually personalize the surgical plan and all the devices to achieve a very particular outcome. And so started the company really digital first, take patient data, take data about the surgeon, create a virtual digital twin 3D of the patient's pathology, then the optimal surgical plan that's then given to the surgeon to review and approve. And then we have design automation software that creates files that can be 3D printed for devices for spine surgery. And what's really unique about this is the devices themselves are essentially programmed to deliver a very specific correction to the spine. And we just published new clinical data showing that using our technology reduces the incidence of revision surgery by more than 74%.
Wow.
And so this is really helping patients significantly. And with surgeons that adopt this technology, they can really integrate digital workflow into their practice that takes that decision-making in the high-pressure operating room environment and moves that to the clinic, where they can make these key clinical decisions and then ultimately implement it in surgery.
Sure. And so what's the scale of the rollout been in operating rooms and hospitals around the country?
We did our very first procedures here in San Francisco.
Wow.
At UCSF. We partnered with them to do the very early procedures in 2021. Since then, we've trained more than 250 surgeons across the US that have adopted this for lumbar spine surgery. And most recently, we just announced we've launched the platform now for cervical spine surgery. So for patients with problems in the cervical spine, we can now create personalized surgical plans and devices to achieve the optimal outcomes.
So you guys are currently offering lumbar and cervical, is that correct?
That's correct, yeah. And so the great thing is it's the same digital workflow. Patient gets a consult, we take their digital imaging, our software processes it, creates a virtual digital twin, optimal alignment plan for that patient, and then 3D print the devices for it. And from a business standpoint, it operates very differently. It runs very much like a software company because we have no inventory. Everything is built on demand, sterile packed, personalized, and delivered straight to the operating room.
What's the kind of timescale then from when you spine is requested versus it's in the hands of a clinician?
Yeah, so I talk about our progression when we did our very first procedures here in San Francisco. That was about 8 weeks from the time when a patient went in to get a surgical consult to when they had surgery. We announced in the fourth quarter that we can now do this in 8 days.
Wow, incredible, incredible. And so I suppose thoracic and sacral surgeries are a lot less common clinically, but is there a plan to roll out to address that area as well?
Where we really focus is on being able to personalize the disc space. And so where there's degenerative disc disease, where the disc has collapsed to the point that it requires to be rebuilt for fusion, we have the technology to be able to address it.
What's the temperature in the room like at JPM this year? What's the appetite for digital twins?
I think it's really strong. Again, day one, a lot of buzz around the transition from traditional healthcare towards enabling technologies and digital. And even if you look at the logo, the JPM has really created a digital first focus this year at the conference. So I think we're going to see a lot of new digital technologies coming out at this conference.
Interesting. And finally, what was your message to investors this year?
We just took the company public. We have 2 quarters under our belt as a public company, and it's really about the transition to mass personalization, driving better outcomes. With our technology platform where it's at, our most recent clinical data, and just in the early weeks of our cervical launch, we have a lot of opportunity for scale right in front of us today.
Fantastic. Mike, thank you so much.
Pleasure.
Appreciate it.
Yeah,
Lovely
it's a lot of
speaking to you.
fun. Anytime.